Heidi Jasper, and I'm an occupational therapy student here at Howard University. Today I will be demonstrating active and passive range of motion and manual muscle testing on the knee joint. The knee is a hinge joint made of the femur, tibia, and patella. It moves in flexion and extension in the sagittal plane with soft and firm end feels. First, I will be demonstrating active range of motion for knee flexion. The patient is in a supine position with the hip and knee in the anatomical position of extension. A towel is placed under the distal thigh. Stabilization of the pelvis will be provided by the weight of the patient's body, and I will be stabilizing the femur. Using the large goniometer, the axis is placed over the lateral epicondyle of the femur. The stationary arm is parallel to the longitudinal axis of the femur, pointing towards the greater trochanter. The movable arm is parallel to the longitudinal axis of the fibula, pointing toward the lateral malleolus. The therapist then grasps the patient's distal tibia and fibula. The therapist will then have the patient move their knee toward their buttocks to the limit of knee flexion. Heather's range of motion is 130 degrees, with 0 to 135 degrees being the normal range of motion. For passive range of motion, the patient is in the same position, supine with the hip and knee in the anatomical position of extension with a towel under the distal thigh. Stabilization of the pelvis will be provided by the weight of the patient's body, and the therapist will be stabilizing the femur. The goniometer is also placed in the same position, with the axis on the lateral epicondyle of the femur. The stationary arm is parallel to the longitudinal axis of the femur, pointing towards the greater trochanter, and the movable arm is parallel to the longitudinal axis of the fibula, pointing towards the lateral malleolus. I will then flex the patient's leg by moving her heel toward the buttocks to the limit of knee flexion. Again, Heather's range of motion is 130 degrees, with 0 to 135 degrees being the normal range of motion of knee flexion. I will then move the patient's lower leg in the anterior direction beyond 0 degrees of extension into hyperextension. Hyperextension normal range of motion is from 0 to 10 degrees. There is no alternate position for measuring knee flexion and extension range of motion.
Now I'm first going to talk about passive range of motion. You start with the patient supine. You make sure to add a roll here to make sure that the knee is flexed about 20 to 30 degrees. You stabilize by placing your hand over the tibia and fibula, and then you position the goniometer. You position the stationary arm following the fibula. Then you position the movable arm along the fifth metatarsal. And the goniometer axis is actually on the calcaneus bone, but it actually comes together where the fibula and the fifth metatarsal join together. So you have the person in neutral foot position. Okay, and then with passive range of motion, you take the foot, you hold them by the dorsum of the foot, and you go forward. Now I'm going to do that again. Start up like this, and then you look, this is 110 degrees. And you push down, and you get, she's at 145 degrees. So that's 35 degrees. Now if I were to do active range of motion, you'd still place the goniometer in the same location, making sure that her foot is in neutral. Okay. All right. Now I want you to push your toes as far away from your body as you can go. All right? Good. All right. Again, 35 degrees. Normal range of motion is 30 to 50 degrees, and the end feel should be firm.
First, I'm going to use a goniometer to assess Heidi's active range of motion. The patient starts in a supine position with a roll under the knee to allow for 20 to 30 degrees of knee flexion. The gastrocnemius is slack and the foot is in neutral position. I'm going to place the fulcrum of the goniometer just inferior to the lateral malleolus of the fibula. The stationary arm is parallel to the fibula and the movable arm is placed parallel to the fifth metatarsal. I'm going to have Heidi dorsiflex for me, or point her toes toward her head. And that's about 20 degrees of dorsiflexion. Normal range of motion for ankle dorsiflexion is 0 to 20 degrees. To assess passive range of motion, the patient is in the same position, supine with a towel under the knee, gastrocnemius slack, and the foot in neutral position. The goniometer is also in the same position, and I'm going to dorsiflex for Heidi, and that also gives us about 20 degrees.